Good morning, everyone. Thank you for joining us today for this media availability with Dr. Souza. This is just to provide a brief update on our operations at St. Luke's and a chance for the media to ask questions about timely issues related to our COVID-19 activity. And with that, also I want to remind everyone to please remain muted and keep your cameras off while Dr. Souza makes his opening remarks. And then when we open it up to questions, please raise your hand, your virtual hand. I will call on you and you can state your organization and your question. Thank you. Go ahead, Dr. Souza.
Thanks a lot, Joy. Hi, everyone. I'll keep these opening comments pretty brief and just try to give you all more time for Q&A. We remain really busy in our facilities, driven by this latest surge of COVID patients. Today, we have 236 COVID inpatients. 54 of those folks are in intensive care. We also have 6 children hospitalized with COVID, and 2 of them are in our pediatric intensive care unit. I gave some public updates on our demographics with this surge probably 7 to 10 days ago. It hasn't changed. The high-level synopsis is that the patients in this surge are younger. Our average age, 2-week average, is 59 years, different from 72 years in the December surge. Our patients are almost all unvaccinated, specifically 90% of the hospitalized patients are unvaccinated, and 98% of the intensive care unit COVID patients are unvaccinated. The patients are sicker with more organ system failures. Their length of stay is longer by about 2 days, and this surge of patients is dying more often. The ICU mortality rate is in excess of 40%, different from the 28% we were experiencing back in December. We're continuing to operate under crisis standards. Our elective green cases are still paused, and they have been since mid-August. Our non-elective yellow cases are still paused, and we recently decided to continue these pauses now through about the 3rd week in October and decide then whether we go further. We're continuing to care for patients in non-traditional spaces, including discharge lounges, emergency department waiting rooms. And then in terms of intensive care, our first overflow unit is at capacity in Boise, and we've now overflowed patients into a second overflow intensive care unit. We're continuing our efforts to load level across the health system, which means, moving patients who maybe don't need an intensive care unit to smaller facilities where they can still get good care. And we're continuing to staff our units in non-traditional ways, whether it's different nursing ratios or different physicians providing the care. We're still operating under crisis. I'll just close with, in terms of projections, it's uncertain, but we believe that intensive care unit hospitalizations and deaths are going to continue to rise in the next 1 to 2 week period. And I could say more on that during Q&A if anyone would like. So I'll maybe pause right there, Joy, and stand for whatever questions the group has.
Thank you, Dr. Souza. So once again, I would ask that people turn off their cameras if you're not presenting, and mute your microphones when you're not asking a question. Please raise your virtual hand and I will call on you. You can also type your question into the chat. And I see we have a question from Joe Paris. Go ahead, Joe.
Thank you. Dr. Souza, on the boosters, per your release this morning, could you explain a little bit more about what St. Luke's is offering now with COVID boosters?
Sure thing, Joe. Thanks. We are administering the third dose of Pfizer to eligible groups. We're following the CDC guidelines on that. You can find those, but briefly, folks older than 65, people with an underlying medical condition, which is pretty broad. It includes obesity and diabetes, as well as cancer and immune suppression and chronic organ disease like heart or lung or kidney. And then folks who work or live in a high-risk setting, and that includes healthcare, education. We do allow, mixing, if you will, of vaccines, specifically meaning Pfizer after Moderna, for the immunocompromised who are in the highest risk group that we've been offering third vaccines to already.
Sorry, can you clarify that? Are you saying that if you got Moderna or Johnson & Johnson, then you are eligible to get the Pfizer booster at St. Luke's?
If you are in the immunocompromised group, that is the highest risk group where we would, where we're again following national guidelines and allowing that sort of mix and match. If you're not in the immunocompromised group, we're recommending that we see what develops here in the short term relative to Moderna and Johnson & Johnson boosters.
So just being 65 or older does not qualify you for that, correct?
That's correct.
Thank you.
Okay, thank you, Joe. Again, we're just opening it up for questions for any members of the media. Please raise your hand. And Jack Schemmel, I see that you have raised your hand. Please go ahead with your question.
Hey, Dr. Souza, just from what you can say, what do you know of what may be going on at St. Luke's Magic Valley or even St. Luke's Wood River Valley as well?
Well, Magic Valley, right, is one of our sites with intensive care unit capacity. So we keep close tabs on that. They were at ICU capacity this morning when I looked. Their floor patients also very, very busy with COVID patients. Again, maybe I'd say here that while our total COVID admissions, I'm going to be optimistic and say we're on a plateau for about the past week. We're not seeing continued rises. We are seeing increases in the ICU patients, and this is because of the natural history of how COVID progresses in patients who get hospitalized. What we're seeing is that some of those patients who were admitted, a week ago and they've been on a medical surgical floor are now deteriorating and needing movement to the intensive care unit. Wood River is continuing to receive patients from Twin Falls and other areas as part of our load leveling effort. Wood River does not have true intensive care unit capacity.
Thank you.
Hope that helps.
Okay, thank you. And Joe Paris, you still have your hand up. Do you have another question or is that residual?
No, I actually have a few questions if no one else has one.
Well, I do see that Carolyn Komatsoulis, apologize if I did not pronounce your name correctly, does have a question. So then maybe Joe will come back to you after that.
Sounds good.
Yeah, so I am just wondering, so you were already giving the boosters to people who are high risk. So the change now is that the general public can get the shots at St. Luke's?
The change is we were giving third doses to patients who are very high risk with immunocompromise. So these would include patients with solid organ transplants, for example. what's new is that we're now giving the Pfizer booster to those individuals who qualify, who are over 65, have any chronic health conditions, or work in high-risk areas like healthcare and education.
Okay, thanks.
Okay, Joe, go ahead.
Awesome, thank you. We get a lot of questions from the community about effectiveness of vaccines and kind of what it means when we talk about reports or research that says after 6 months, the vaccine is less effective. For starters, could you explain what less effective means? Does that mean it's less effective in, I guess, preventing sickness, or it's less effective in preventing hospitalization?
Well, so far, our evidence is that it's less effective in preventing infection. So we've seen a significant drop off in the efficacy of the vaccines over time in going from exposure to infection. When you talk about going, however, from infection to hospitalization, and hospitalization to intensive care unit hospitalization, and intensive care unit hospitalization to death, the vaccines are highly effective. I'll just double down on our data. 9 in 10 of our hospitalized patients are unvaccinated. And 98 out of, well, we don't have 100 COVID ICU patients today, but 98% of our COVID ICU patients are unvaccinated. So, yeah, I've used the kind of analogy before of, body armor, or maybe a better one is a seat belt. Wearing your seat belt doesn't mean you're not going to get in a car crash. Just like having a vaccine doesn't mean that you won't acquire COVID, particularly when it's as rampant as it is right now in our communities. I mean, you literally can't go anywhere and not avoid exposure, especially when nobody's taking precautions to prevent it. But wearing a seatbelt means that even if you get in a car crash, you're highly likely not to die. So too with the vaccines. Hope that helps.
That's exactly what I was looking for. And I guess the quick follow from that is, I guess we get a lot of questions on a daily basis from people who are not currently eligible for a COVID booster, but they say, I got my vaccine 6 months ago and I'd like to get that effectiveness raised. I guess I know that it's time will tell, but what insight would you have for members of the community that are not eligible for a booster now that would like one?
So first of all, the inclusion criteria are pretty broad. And again, if you go to the CDC website on chronic conditions, a giant swath of our public would qualify. So please do look at that. If you don't qualify, that's for solid reasons. And you should feel confident that you're still highly protected from hospitalization, ICU hospitalization, and certainly from death. Moreover, there are new treatments, right, that have come online and are available now, including antibodies. So if you were to acquire infection, always seek care from your provider and see if you qualify for any of the treatments that we use to actively treat infection, whether those are supportive treatments like steroids or more specific treatments like monoclonal antibodies. That'd be my advice.
Okay, thank you. And Ariana Piper, please go ahead with your question.
Hi, so my question was just if someone got COVID originally during that first strain back in the winter, how likely are they to be reinfected? And if they are reinfected, how likely are they to be placed in the hospital? Because I've had a lot of people ask me that question, so I was kind of curious what you guys have seen.
So let me say it this way. Our current surge, I've heard the term, it's a pandemic of the unvaccinated. I think it might be more accurate to say that this is a pandemic of the non-immune. Let me explain what I mean by that a little bit. So we are seeing, if you just listen to the statistics I shared, we are seeing a very small handful of patients who have been vaccinated who get sick enough to be in the hospital or sick enough to be in the ICU. We see that. We see a few more patients who previously had confirmed COVID who end up sick enough to be in the hospital or sick enough to be in the ICU. And we have seen a handful of deaths in that group of individuals. But largely what we're seeing, right, is people who have either not been infected or not been vaccinated. Now, on that point, I can't help but miss the opportunity to say that if you're non-immune and you haven't been infected and you haven't been vaccinated, you have a choice to make. And you can either choose to become infected, because you will. This highly contagious Delta variant is going to find every pocket of non-immunity given enough time. You can either choose to become infected or you can choose to get vaccinated. If you get vaccinated, it's very safe and it's very effective. It'll reduce your chance of infection to maybe 65, 70% risk, and it'll reduce your hospitalization, by 90%, and reduce the risk of ICU hospitalization and death by 98%. If you choose to get infected with COVID, you have a much higher risk of hospitalization, ICU hospitalization, and death. If you seek treatment, there will be effective treatments. I do want to point out that the monoclonal antibody you might get is effective. The vaccine that you would alternatively get if you chose the vaccine would be just as effective, actually more effective, and it would cause you to make your own natural antibodies, not antibodies that are created outside your body in the lab. So you're getting the drift. I'm trying to encourage people to get a vaccine for their own benefit and the benefit of our communities and our hospital capacity for care.
Thank you. And Audrey Dutton, I see you have a question. Audrey, go ahead.
Audrey, I wonder if you're on mute.
And if you're having trouble with your microphone, please feel free to type your question in the chat and I will read it. In the meantime, Ariana, did you have a follow-up question?
Yes, so basically what you're saying is even if you've been infected before in the past and you may not end up in the hospital, you recommend just getting the vaccine just for that extra protection?
Absolutely. Absolutely. Because the treatments we would offer, we'd offer antibodies. So let's use our own bodies to make our own antibodies against this infection.
Okay, thank you.
Yep.
Okay, and Audrey's still typing her question in. So Joe Paris, I'm sorry. Joe, did you have follow-up question again?
I did, and I think Ariana's question might have got at this, but I'll ask again just to be clear. We have people in our community that continue to comment to us that I had COVID in X time frame, and so I don't want to get the vaccine because I have natural immunity. There's no reason to get the vaccine. For the camp of people in our community that say I'm not going to get a vaccine because I have natural immunity, would you explain, I guess, if that's a smart decision or a scientifically backed decision or something that you would advise against?
So the story of immunity with COVID is a story that's yet to be fully written in terms of our understanding. I do believe that 3, 4, 5 years from now, we're going to have a much more complete and accurate picture of how immunity works with COVID. What we know is that both vaccine immunity and natural immunity appear to wane with time. That's borne out by our own lived experience as healthcare providers caring for patients. We see rare cases of vaccinated individuals who get admitted to hospital or the ICU, and we see a few more previously infected and unvaccinated individuals get admitted to hospital and ICU. The point is that immunity wanes over time. So I would just maybe come back to a similar version of what I've already said. So faced with that choice, someone who's already had COVID, hopefully doesn't have long haul symptoms, and maybe lucked out the first time and that did not occur, they do have a choice. Our current understanding is that immunity will continue to wane over time. We don't know how quickly, and we don't know if it will completely drop off or just drop off to some partial immunity. Again, a story that is still being understood and yet to be written. But the choice is, do you run the risk of a reinfection, potentially with the risk now of a worse outcome or long-term COVID symptoms? And that is a syndrome that we just simply don't understand yet. So do you roll those dice, or do you get a vaccine that's really designed like a bullet, not a bomb, and is going to give you specific antibodies directed against this pathogen? So when you encounter it again, because COVID's with us for the long haul here, it's going to be part of what people bump into for a long time in our future. So when you bump into it again, you're protected.
Great, thank you. And I think that Audrey's question in the chat, I think you've kind of addressed that with that last answer. But if you have anything else to add.
Yeah, Audrey, it's a good question. I think so. Audrey's question is, we've heard that if you've already been infected and then get vaccinated, you have great immunity. True. Is the same true vice versa if you get vaccinated and then get infected? And the answer is, that's what the evidence would suggest, and it's what we believe at this point in time, and more to come on that as we gain a deeper understanding of immunity from COVID.
Thank you. And Ariana, I see that you raised your hand again.
Yes, I just had one more question, and we've kind of covered this, but just to clarify, how long is the immunity from the vaccine so far? I know we're probably still studying and figuring that out. And on top of that, does that mean we'll have to kind of keep getting boosters, or do you think over time we'll figure that out more?
Yeah, I'm going to stick with stay tuned on that. I mean, we're following guidelines and saying, you've got to be post-vaccine 6 months. We don't know what a long-term vaccination program might look like. There's active research happening now trying to create a stem vaccine, if you will. This meaning a vaccine that might provide broader based immunity for not only this coronavirus, but other coronaviruses as well. That's an active area of research and development. I just need to stick with stay tuned on that, I'm afraid.
Thanks so much.
You're welcome.
Okay, and I see that Joe Paris raised his hand, and I think that pretty much brings us close to the end after Joe, but go ahead, Joe.
Yeah, final question. Thank you so much for all the time. In terms of, I guess, questions we've gotten about being over-vaccinated, we've had a misunderstanding or some confusion among our viewers asking, if I have to wait 6 months to get a vaccine booster, does that mean if I only waited 3 or 4 months, I'd be over-vaccinated and have too many antibodies? I guess, can you explain that the 6-month waiting time, is that out of precaution, or is there evidence that suggests if you get vaccinated or a booster too soon after a dose, there could be issues?
Yeah, I wish I had an immunologist here to answer some of these questions. I'd come back to it. It's an allocation of resource issue, and providing care when we need to provide that care, not just because. So we want to provide a booster when providing a booster is proven to be beneficial or thought to be beneficial according to the latest science. Each of us encounter innumerable pathogenic stimuli every single day. I mean, through your skin, through what you eat, through what you breathe in, other pathogens. So I don't want to create any sort of fear that getting an extra shot, and especially a shot as benign as these COVID vaccines and as targeted as these COVID vaccines are, I don't want to create any fear that somehow like overwhelms your immune system. Our immune systems encounter just too numerous to count pathogens literally every day that we wake up. The point is, we only want to give an injection and a vaccine when we need to. So we're just trying to match the regimen with the actual need that creates benefit. Hope that answers your question.
It did. Thank you so much.
You're welcome.
So Dr. Souza, any closing remarks besides get vaccinated if you're eligible and get your flu shot?
I do want to encourage get your flu shot. We're definitely seeing admissions to our hospital with other respiratory viruses. No surprise, given that the mitigation things that we were all doing last year have largely gone by the wayside. So respiratory syncytial virus. I mean, we've got a couple of sick kids in our PICU with RSV infections. My request to the public, I've been saying this for a while. I've only modified it just a little. So if I could say this, I'm going to grab the opportunity. If you've been vaccinated, please tell your own COVID vaccine story to the people around you. Let them know that it was safe, that you're still here. And please be brave and speak up in the face of the misinformation that's literally killing people now. If you haven't been vaccinated, please talk with someone you know who may have been. Ask them about it. And I hope at the end of that you make an appointment, because if you do, we're not going to see you in our hospitals. And then finally, and I'm just repeating what I've said in other media events in the last couple of weeks. please thank a healthcare worker today. I'd challenge you to do that through the rest of the year, at least once a week. If you know one of us, send a healthcare worker a text or give them a call. And if you don't know one, just write a card, send it to St. Luke's or St. Alphonsus or Primary Health or to your own doctor's office. Our people really need the wind in the sails right now, given the fight we're engaged in. Really appreciate everyone's time today.